Dear students, welcome back. In the previous session, we have discussed about gait terminology. Now in this session, we are going to discuss about the kinematics as well as the kinetics of the gait. Okay, kinematics is the term used to describe movements without considering the internal or external forces that caused the movements. Normally, these measures include positions, velocities, and accelerations of body markers or body segments. There are many sophisticated equipment which are present to calculate this kinematics of the gait. In them, the first one is stroboscopic photography, and then cinematography and electrogoniometers. And more recently, many types of computerized motion analysis systems have provided for comprehensive information about limb positions and their motions in normal and abnormal gait. And another method called as observational gait analysis, which employs a less sophisticated and less objective method in which an observer makes a judgment as to whether a particular joint angle or motion varies from a normal one. Okay. So for this, it is having one disadvantages of observational method of analysis is that it requires a great deal of training and practice to be able to identify the particular segment of the gait in which a particular joint angle deviates from a normal when a person is walking. Okay, and next type of analyzing this kinematics is the trajectories. Trajectories were the paths in space of particular parts or of particular interest. For example, the path of the toe during gait is important in research into trips and falls, like that. And next one is the joint angles. Joint angles are the primary importance in recording gait. They may be expressed as absolute position in space or more commonly as the relative angles of the joint between adjacent segments such as the hip or the knee. In most literature, the anatomical position is called the zero position of the joint. So we are going to know the joint angles in the sagittal plane during the gait cycle. Okay, so that is the thing we are going to study in this session, that is joint motion. Okay, so this joint motion was recorded by the Gait laboratory at RLA Medical Center, who developed observational gait analysis, which helped the observer to focus his or her attention systematically on different portions of the body during gait. Okay, so they have given the range of motions. They have given the range of motion at each phase of the gait, and these are the joint angles they have given at the end phase of each event. Okay, now we are going to see what are the joint angles which are required for initial contact, foot flat, mid stance, heel off, toe off, and also in acceleration, mid swing and deceleration. Now we will see. So what is the first phase in the gait cycle? That is stance phase. Stance phase includes how many events? One is initial contact, foot flat, mid stance, heel off and toe off, isn't it? Now, so what are the joint angles which are required for the initial contact? Okay, so for the initial contact, the hip requires, okay, hip requires 20 to 30 degrees of hip flexion. Okay, it requires hip flexion, 20 degrees of hip flexion here, and then okay, if you see the remaining joints, that is knee and at the ankle, it is in ankle is in neutral position, and there is no angulation at the knee, that is 0 degrees, so it is in extension. Okay, so hip flexion, which is required for initial contact, is it ranges from 0 to 30 degrees of flexion. Here they have taken 20 degrees. Next one is foot flat. So foot flat, we can call it as also loading response. So for this, what is the range of motion required here? Joint angles. At the hip, it requires 15 to 25 degrees of flexion. Okay, and then 15 degrees of flexion at the knee and 5 degrees of plantar flexion. So at the end of the mid stance, so at the hip there is no flexion is taking place, so it is at 0 degrees. That means it is in neutral position, that is anatomical position. And then 5 degrees of flexion we can see in the mid stance at the knee joint, and 5 degrees of dorsal flexion at the ankle joint. Okay, next one is the heel off. In the heel off stage, okay, so we can call it as this heel off as end of terminal stance also, the face. So it requires 10 to 20 degrees of hyperextension. At the knee, no angulation, and also at ankle, it doesn't have any joint range of motion. Again, it is 0 degrees. But at the level of toes, we can find 30 degrees of hyperextension. We can see at the metatarsophalangeal joints. Okay, now if you come to next stage, that is toe off, here the hip, at the hip we can find 10 to 20 degrees of hyperextension we can find, and 30 degrees of flexion, knee flexion, and 20 degrees of here plantar flexion. Here we require 20 degrees of plantar flexion, and at the toes we can find 50 to 60 degrees of hyperextension we can find here. Okay, so these are the joint angles in the stance phase. Now we'll move on to the swing phase. So at the hip we can find 20 degrees of flexion. So at the, this one is initial swing. At the end of the initial swing we can find 20 degrees of flexion, 60 degrees of flexion at the knee, and 10 degrees of plantar flexion at the ankle. Okay, and in the mid swing, end of the mid swing, it requires 30 degrees of flexion at the hip, 30 degrees of flexion at the knee, and 0 degrees of that is neutral position, 0 degrees at the ankle joint. Okay, this is mid swing. And coming to the deceleration or the end of the terminal swing, it requires 30 degrees of flexion of hip and no joint angle, that is extension at the knee, that is 0 degrees, and neutral position of the ankle we can find here. So these are the joint angles found in the sagittal plane, which includes the kinematics of the Gait cycle. Okay, now we will move on to the kinetics. Okay, so normally the kinetics here we can see. So kinetics is concerned with the forces acting on the body that are the cause of the movement. Okay, a kinetic analysis is performed to understand the forces acting on the body by the supporting surface, the forces acting on the joint, and the forces produced by muscles, the moments produced by those muscles crossing the joints. So all those things we have already studied in the static posture, that is in erect standing posture we have studied the same things. Okay, and the mechanical power generated or absorbed by those muscles and energy patterns of the body during walking. Now we are mainly concentrating at the forces. One is the ground reaction forces and the center of pressure. COP is the center of pressure and the ground reaction forces. So the ground reaction forces or the forces being applied to the foot by the ground. Okay, normally if any two objects are in contact, so foot and ground is contact. So foot is acting on the ground, that is foot on ground. Now here gravity is acting on the foot, that becomes the ground reaction forces here. Okay, so these are the forces being applied to the foot by the ground when a person takes a step. These forces are equal in size but opposite in direction to the forces applied to the ground by the foot. So the ground reaction forces are expressed using vertical, this may be vertical, and anterior-posterior and mediolateral axis. If we combine the force components in 2 or 3 planes, the vector sum is a single expression of the ground reaction force, and which is termed as ground reaction force vector. So here we are referring this as a single component. So the ground reaction force is formed by the forces which are acting in different planes, and the final resultant vector for all these forces are the ground reaction force vector. And so here we are referring this one as a single component, and these components are combined as a single vector. So here in sagittal plane we use ground reaction force vector to analyze the movements. Okay, and next one is the center of pressure of the foot. The COP on the supporting surface is the point where the resultant of all the foot forces act. So that means the contact portion here, if you can see the contact portion of the foot with that of the ground. Okay, so and this GRF and COPs are the characteristics of normal walking to understand how these forces are acting during the gait cycle. And a moment of force, usually referred to simply as moment, is same as torque. That means here if you can see, if this is the COP at the initial contact, that is heel strike. So the heel is on contact with that of the floor, that point becomes the center of pressure, and from that point only the ground reaction force vector is arising, isn't it? So where exactly this GRF is falling, whether it is falling or present behind the joint axis or in front of the axis. If it is present behind or in front of the axis, what is the resultant moment is going to taking place at that particular joint. So these are the things we are going to study in kinetics. So here is the initial contact. If you see the ground reaction force vector, so at the ankle joint, the GRF, the ground reaction force vector, is present posterior to the ankle joint. That means which is causing what kind of moment here? Dorsiflexor moment. And here at the knee joint it is present anteriorly, and the hip joint also it becomes anteriorly. So then what is the moments which are going to take place here at the knee, which causes flexor moment? At the knee, which causes flexor moment, and at the hip it is causing flexion actually, and which is opposite, the internal force is the extensor moment. Here also at the knee it causing extension because of the proximal moment of the femur. So the internal force is here is the flexor moment. Okay, now so in the foot flat still this ground reaction force is present behind the ankle joint. Okay, behind the ankle joint, which causes plantar flexion, and the internal moment is the dorsiflexor moment. At the knee joint, so which is falling behind the knee joint axis, causes flexion, and it causes extensor moment. And at the hip it causing flexion, the internal moment that is causing the extensor moment at the hip joint. Okay, in the mid stance again it comes on the anterior to the ankle joint, which causing the dorsiflexion, and the internal forces or the plantar flexor moment. And at the knee it causes flexion, and the internal moment is the flexor moment. And here it is causing extension at the hip joint because it is falling behind, but this one is opposed by the flexor moment. So if you see, some of the internal net moments are present, which helps in the maintenance in that position. Okay, so and next we will move on to the next phases of the gait. So that one is the mid stance, we have finished now, and next one is the heel off. In the heel off position, so it comes almost at the metatarsal level, so which is causing, which is almost away. So this is the thing which causes dorsiflexion here, and this one is the internal net moment here is the plantar flexor moment. So again here knee extension because it is on the anterior aspect, but this one is opposed by this flexor moment. And again 20 degrees of extension is here, and this one is counteracted by this flexor moment. And now here you can see at the toe off, so the toe off almost all 60 degrees of hyper extension, which causes 25 degrees of plantar flexion and 30 degrees of flexion. The extensor moment is taking place at the knee joint, and flexor moment at the hip joint. So these are all the forces. One is the ground reaction force, which is creating the motion, and that one is balanced by the internal net moments by the opposite groups. So these are the things which are taking place during gait. And if you can see the center of pressure at the foot, Okay, yes, the COP, if you can see, the COP is going to change in different positions of the gate. That is, you can find a pathway, so which is shown or which is highlighted in the black dots. So at the initial contact, the COP is present at the heel, and at the flat foot, it is almost come anterior to the heel. This is the point of center of pressure, and if you can see, just before heel off, it is almost reaching to the level of metatarsals. Okay, and just before toe off, it again reaches to the metatarsophalangeal joints. So these are the COPs which can be seen at different points at different stages of gait. So these are all about the kinematics and kinetics of the gait. Thank you.